good evening, whichever part of the world you're listening to this podcast. My name is Yanick Hicks. I'm your host for ACHE, American College of Healthcare Executive Healthcare Leadership Podcast. We bring you leadership ideas and tools so you can become a better healthcare leader. Today we have a special guest. He's going to talk a little bit more about what he does, but he's the CEO of mypediatricdoctor.com, QC Healthcare. I mean, he's been an advisory member for different healthcare organizations. He's been in the healthcare information technology for extensive amounts of years, advisory member for Coalition of Health AI, for AI before. He's part of HIMSS, if you ever heard of HIMSS. He went to Washington University in St. Louis. That's where he got his master's in business administration. He's a healthcare mentor as far as AI, IT, executive business for University of Georgia. That's actually my alma mater. So he has, but that's just a little bit about his background. He's going to share a little bit more about him, about what he currently does, and how this can really help, especially the rural healthcare communities, even some of the health systems, with healthcare information technology tools, telehealth, and all those things. So welcome, Eric. Thank you for being here today.
Hey, thanks, Yanick. I appreciate it very much. And again, good morning, good afternoon, good evening. And we're 24/7, so I get it. So we're available any time of the day. And so anybody who's listening, any time of the day or night, we're available.
Well, that's good. So, so we just kind of go right into it. So QC Healthcare, which you're launching, operates across telehealth, pharmacy services. Of course, my background is pharmacy. And when I saw that, it intrigued me, AI, analytics. What inspired your vision for, building an integrated healthcare innovation company? And where do you see the biggest opportunities for transformation in healthcare over the next 5 years?
Yeah, great question. And thanks, Yanick. Yeah, your pharmacy background, I'm fully aware of that. And again, I think I mentioned I ran pharmacies too. So, but in that world, and my dad was a pharmacist, and my mom ran the Illinois Pharmaceutical Association for a number of years. So pharmacists are very near and dear to my heart. QC Healthcare, and this is really for everybody listening and watching this. The definition of QC Healthcare is quality care. QC in QC Healthcare is quality care. And we've really set up it as a true ecosystem. And imagine kind of a hospital in the middle of a state and how it kind of services individuals across either a county or a couple of counties. Ours is actually an ecosystem that goes around the world. Right now, it's obviously US-based, but our whole kind of go-to strategy is really that international component. And it is really built on a couple of key areas. And you mentioned a couple of them. Number one is a vertical on telehealth. And so we launched a couple of months back, My Pediatric Doctor. So looking at the pediatric, obviously, patient base. This next week, so basically the week of June 29th, we'll be launching the adult complement of that. So both of them will have urgent care. Both of them will have primary care settings across the entire 50 states, across the United States as a whole, which is awesome. 24/7 access on the urgent care for both pediatrics and adult, and then 24/7 access and scheduling appointments on the primary care side of things for both business units. And then basically from there, then we're going to look at building up other ecosystems. So think in terms of specific specialties. We're looking at things like my oncology doctor, my cardiology doctor, my respiratory doctor, and literally have specialty units built around those telehealth systems across the country to work as either referral services or basically primary care-like settings for those specialties. And then also on top of that, we're looking at setting up a VA component. So my VA doctor looks at both national and international veterans and their families because of the pediatric component, which is really cool. So think of mental health, think of other needs they might have, cardiology, et cetera. And then even on the outside of things, not ACHA related, but we're looking at also bringing in veterinary services as well. And then kind of capturing that is all of the data and all of the kind of connectivities that those kind of business units would have across the spectrum of healthcare. You mentioned pharmacy. We're looking at real-time delivery of pharmacy medications. So not only can you go to a CVS or a Walmart or a Walgreens to get your prescription, we're looking at ways of getting basically direct deliveries of prescriptions where you don't even have to leave the home. The other side of it is really I would say the clinical trial and the drug development side of things, where we're looking at really kind of capturing kind of an essence of what's needed in the marketplace. Is I'm capturing obviously the patient base, the pediatric patients, the adult patients, and kind of the complements of all their different conditions and disease states. The ability to then tap into those demographics for clinical trials is going to be so much easier than what's being done right now. So if a pharma company comes to me and says, hey, I'm looking at this clinical trial for this drug, what can you do from a patient standpoint? Within my system, I'll be able to tag basically patients directly, figure out what works for that clinical trial, find out if they're a match directly. Do they want to be in that clinical trial? And then place them in that clinical trial directly. So some pretty cool nuances there. And then all of it kind of wraps around AI. And that's obviously, I'm sure, on top of mind for most of the folks that are listening here. A lot of the tools, a lot of the kind of things that I'm looking to bring into the systems are pretty much having some type of AI touch. It could be a screening tool or diagnostic tool. It could be IT related, where I'm doing some things intermixing within the systems themselves to really, again, provide access and efficiencies. But a lot of the kind of tools that I'm looking at are supporting, obviously, the kind of end result, which is access and then efficiency to bring that care to people, both in the rural settings, but also in the urban settings.
Wow. I mean, even I do a lot of work, of course, even in the rural behavioral, access is one. And you just kind of touch on it. I mean, basically, access and artificial intelligence. So, talking about like access to care, especially in this rural community, what impact have you seen telehealth making improving access and outcome for patients who might be otherwise facing barriers to receiving this care?
Yeah, I mean that's just it. I mean, everybody has a phone now, right? So I mean, the care is there. I mean, obviously you've got some folks that are really rural. I mean, like Alaska, and I would say some of the northeast states like Vermont and New Hampshire, some really access issues because of the mountains and areas that they live in. Those are some outliers. But in general, most people have some type of a phone or access to getting connected to our care. We are web-based, app-based, so they are able to get into basically the web application, basically put their kind of demographic information into the system, and then see a doctor within about 15 minutes, which is obviously pretty cool access from that standpoint. Where we see kind of a need is that if you've got those hospitals that are in, let's say, North Dakota, South Dakota, here in Georgia, as an example, if you're down south about an hour south of Atlanta, it's considered rural. North of Atlanta, it's considered rural. And so how do you make those connections work? And so a lot of it, what we're doing is working with either hospitals or clinic services within the states and really kind of saying, hey, we're here. We're able to do 24/7 care. We can do it after hours. We can do weekends. We can do urgent. And so really getting that access need taken care of, where the patients don't have to worry about driving into a hospital or clinic. We're kind of the triage that's needed within those systems and basically provide that care in real time, literally and figuratively, for their patient base.
Wow. Because, that's so powerful because, transportation is always been one of the issues of things, transportation to and from appointments and so many things you hear about.
It is. It's a cost burden. It's a time burden. Then the other, think of somebody who's really having a tough time getting around. I mean, just to get them out of the house, into a vehicle, then into that location, clinic, hospital, whatever. And then once that's done, you got to reload them up and take them back and do the same thing in reverse. So it is, a really a cumbersome type of activity. And if there's a way to really, truly streamline that, make that access key, but also make it efficient, which obviously this does, that's a huge win-win. And so kind of on the back end, what we're doing in many cases is we're working with organizations that can use some of the tools that allow that to happen. So think of some diagnostic tools, having those shipped to the home. there's a lot of really cool AI applications now that are actually being built to use just with your phone or an iPad, where they can take pictures and kind of hear and listen and things of that nature. So there's an AI component there where you don't need to have a device. So those are the areas where our kind of QC healthcare stance is looking at ways to tap into efficiencies in those types of products to really speed that access and diagnostic care for that patient.
Wow. That is incredible. How long have you guys been working on this application? How long has it been now in the
Yeah,
market?
so we
Yeah.
started My Pediatric Doctor 2 months ago. So that is up and running. As I mentioned, we launch My Adult Doctor launches next week, and then the other complements will pretty much launch about every 2 to 4 weeks after that. So we got a pretty busy 2026. But then it becomes even busier in 2027 because then everything goes international. So everything that we're structuring and the way we've structured the businesses is the ability to move the same verticals into an international structure. So basically within countries, we're looking at going into the medical schools in the countries and then expanding the services in country by the use of that medical school.
Wow. But I thought that, I mean, I'm of course a foreigner from Cameroon. And what I
Yep.
saw when I was kind of doing some research and talking about being global and utilizing those services, I thought that was really powerful. Uh, you know, Gaining access to healthcare if you're probably in another country or maybe in a different place or an environment, just kind of
Exactly.
utilizing some of the telehealth and some of the tools, technologies, and things that you guys have. I think that was I really paid attention to that. You talk about
Well,
artificial.
I'm going to mention though. So Cameroon as an example. I mean, that's where we are looking for again, think of rural health in the United States. Well,
Yeah,
there's a lot of countries that are rural health, right, that have that
yeah,
need. And so if you can tap into those services where, again, most of them do still have phones, the access point is there. The coordination is there to make it happen. And then really it's, again, working with those medical schools within those countries and then working with their residents and doctors to really expand it into the country. I mean,
yeah,
that's a win-win for obviously the medical school, but it's a win-win for the country. And if we can really do that efficiently, which I know we can, based on the technology that's out there, that's going to be huge for patients to get the care that they don't have today.
yeah. What made you guys decide to maybe consider going global or utilizing that and going into some of those other countries and their medical schools and incorporating that? It's pretty intriguing.
Yeah, well, I'm actually on a medical board in Aruba. So there's a medical
Mhm.
school in Aruba that's similar to Cameroon, as you know,
Yeah.
where basically, they're in I would say not it's a vacation destination, but the background of the individuals who live there permanently are, kind of in that rural niche where there's not a lot of healthcare available to them. And even the folks that do travel there, there's not a lot of healthcare available to them. And so things like that, that's basically where that passion came up, where I know that the need is there. I know that the technology is there, and to put those together, it can happen. And with telehealth, it definitely can happen just because you don't have to worry about having to travel someplace to get care. You can basically talk to somebody and then obviously get the care that's needed. What I'm still trying to work on in the back end is the prescription side and how to
Okay.
get the prescriptions to them. That's something that hopefully in time I can figure out. I mean, drones are kind of amazing now. So there's some things
Mm.
that you can tap into, in the future. But right now, it's really kind of getting the care set up, and even if they can just talk to somebody and figure out kind of what the next steps need to be, that's I think of huge value.
Yeah, that is really great. Think just, I mean, that's the essence of leadership, of entrepreneurship, or of just continual innovation and your company, and it's continual leading the innovation space. So, bringing it to leadership, of course, which most of the people, of course, listening to this podcast are healthcare leaders, emerging, evolving executive leaders. And being in this leadership innovation space, what are some leadership lessons that you've learned in your, extensive amount of years in navigating change, growth, and disrupting and disruption in today's healthcare landscape or environment?
Yeah, well, I think the biggest thing for me is I embrace change, and really that kind of goes both ways because, as everybody who's listening to this knows full well, is that the only constant in healthcare is change. And so I think if you have that kind of mindset where if you understand and just take that on, head on, that's a key component. And if you understand that, you know that things are going to be different at some point. Something's going to happen and something's going to change, and you've got to be flexible and nimble to handle that. And so I think within the confines of my past roles and kind of what I've seen work well. If you are nimble and you're able to kind of accept that, then you're going to have a great running organization, a great running team. I think the biggest thing that I've really also seen are those strategic partnerships and working hand in hand with groups, be it a hospital, be it a health network, be it a medical device company or a pharmaceutical company. Really truly finding those partnerships and working together on those partnerships to truly build an organization. I think within kind of the confines of our conversation here, the folks that are listening to this, I mean, they're leaders of hospitals and health networks probably across the country. What they're looking for is a partner to work with them and not be a vendor, to not be somebody that's bringing, quote unquote, the next best thing. They want something where they can truly grow with that other organization and build something amongst themselves with that other organization. And so that's truly what I bring to the table and have seen work and work very well. And I feel that, over time, you'll have a true relationship between two businesses because of that.
Yeah, I mean, if in today's environment, if you don't really embrace change, you're gonna be left behind. Like I always
Yep.
said, you have to constantly, even if something maybe looks like it's working, you still got to be able to challenge it, and you got to look for ways to evolve because you're gonna stay behind and you're gonna become outmoded. And when I talk to leaders who aren't willing to embrace change or continue to evolve, I just said, hey, you're going to be like Blockbuster. You're going to be busted.
Yeah. It's so true. It's so true.
Yeah.
Yeah, and you look at the flip side, look at Netflix, right? So I mean, it
Yeah.
went from the delivery of the DVDs to now they're massively, obviously successful on the online side. So things like
Yeah.
that can make a difference. And AI is a change mode. So there are folks that are out there, I'm sure, that are looking at AI, and if you're not, you need to be. But there's the AI switch, and I think if you look at AI as being a tool and not something that is to be afraid of, I think you'll understand it better and really kind of look at ways you can bring AI into organizations at different levels and at different speeds. Again, you don't have to go right in with everything, but start piloting projects around AI, evaluating it, and see what works and what doesn't, and get a better handle on it. And I think it really will, I think, drive your business going forward.
Yeah, I remember when they're talking about AI, I was I was not at I wouldn't say the forefront of it, but I didn't really use it. I didn't really open my mind to it. And I remember, I think it was sometime last year, early last year, and a friend of mine said, "Hey, why aren't you getting involved with AI?" And he began to show me some stuff, and that's how I began to learn it. And now I don't remember a single day that can go by without me utilizing AI. It just makes my work just increase efficiency. It's a great leverage tool. If you really want to leverage your impact, I'm just so glad that I was able to embrace it and utilize it now in my
Yeah,
business.
and what's becoming more and more scary is that a lot of the AI that's happening, you don't even know it's happening. When you're on the phone and making a phone call into whatever service, a lot of times now all of that is AI driven. If you're getting a chat bot, that's AI driven. So there's some
Mhm.
things that are happening, even just that you're now thinking in terms of commonality that's happening every day that you're not even quote unquote using AI, but it's in the background being run. So it's pretty crazy where we've gone in basically 2 to 3 years.
Wow. By the way, what got you into the healthcare IT space, technology and stuff in the first place? You had a dad that was a pharmacist. I mean, you still have the healthcare background, but you didn't go to pharmacy school. You decided, hey, I'm gonna do something different.
Yeah, I think it was a couple companies ago. Basically was leading a company that was in that space specifically, which I thought was pretty cool. And we started running under the AI and the data analytics side, and then had a partnership with a major data analytics company. And so because of that, I just saw the beauty and I think the future of where data was going and where AI was going and how that relates to healthcare. And I also just saw the ways that AI and data analysis would truly drive a lot of the initiatives around healthcare. I think a lot of times as I said, there's the inefficiencies that have been going on in healthcare. The time it takes to get an appointment, the time you have to travel to get to an appointment, the time it takes to get to a prescription. All of that is time is money, right? And so
Yeah.
there are so many different efficiencies that you can put in play by use of AI and that data analysis that truly drive things forward. And I even look at the clinical trial side. Now they're able to really run obviously multiple kind of sets of data and figure out, how a drug may work and will a drug work better this way or that way. That's all AI now. They can run what's called digital twins, where they literally run data basically against each other to see which works better. And so through that, and AI being kind of at the forefront of it, they'll be able to find better and better ways of discovering drugs, better ways of getting safer drugs. And so all of that wraps around AI and data analysis. And so I saw that as kind of what's going to happen. And so how do you start a company and an organization that can really be at the forefront of doing that?
Wow, that is so. I wouldn't really consider myself like the technology, but you just got to be able to embrace and just be open to learning and changing, right?
Exactly.
That's you have high tech, you have high touch. You need both if you really want to advance in healthcare. And I love what you guys do in, just telehealth. And I know what it is in being in a rural area and not have access and transportation issues and health issues and medical. I hear some of these complaints and it just burned my heart because I work with, most of this healthcare organization, right, in rural health and behavioral health. And when I listen to some of those issues, it just burns my heart. So having something that they can have access is incredible and making it easier for them and more accessible.
Yeah, and I'm even going to go the other way because this is one thing where again your audience is probably very very keen on this. Then you have the other side of it where there's the physician burnout, where you've got the
Mhm.
physicians that are really burdened with a lot of
Yeah.
things when they're in a clinic and or hospital. And so I think where telehealth really kind of helps that is that we can take that burden off. And it could be again like a triage system during the day where you've got basically a telehealth service getting access to customers or patients that are wanting to basically get their care at a hospital or clinic. The triage could be the telehealth service, but it's also the after hour service. It's the weekend service. It's the vacation fill-in time service. So when folks are listening to this, think in that term and that modality where telehealth can be a complement to the services you might already have within your health network. That's where the beauty of the system and the access comes into play, where you literally have real-time access to physicians, no matter where that patient is. If they are close and can get into a clinic and need to get into a clinic, great, go. But if there is a need where they can triage the patient, they don't need to go in, they don't need to be transported, et cetera, you can handle that on telehealth. And so I think that's where the real huge benefit of the folks that are listening to this will hopefully see and take it as an advantage to them to basically make a great connection point with their patient base.
Wow, that's incredible. Hey, you can be on a cruise and be able to have access to
Exactly. You could be on Mount Everest and call your doctor.
call, call your doctor. So, what was some, kind of go, what is something that you like to do for fun beyond work and healthcare? What are some of your hobbies?
Yeah,
Um,
I'm pretty healthy as you can probably imagine. So I do work out. So that's kind of that's a pseudo hobby. I do enjoy doing that, getting out and golfing, getting out and hiking and that type of thing. Love exploring, love traveling. I travel quite a bit with different meetings and all. So I do get around, which that's pretty awesome. I have a number of kids, so spend my time with them as well. So I've got an extended family that is across the country, so do a lot of traveling up and down there. So yeah, I keep I would say pretty active, but obviously I got to run my company too. So that's part of my love too, to be honest. It's my passion project. And so a lot of the work and energy I put into the organization, is part of that love. And so it's, I don't call it work. I call it a mission. And it's basically what QC Healthcare is driven to do. And it's basically a mission to improve healthcare. And, I think I've structured the organization to be able to do that wholeheartedly and really make a difference, not only in the United States, but also globally.
Oh, that's excellent. Yeah, I don't know about golfing. I'm not that good at golfing, but definitely I love hiking. I love hiking. Soccer, of course, is sports.
There you go.
I'm probably going to a soccer tournament this Saturday. I haven't played in a while, but I saw that Sandy Springs has that. I was like, maybe we should get back a little bit on shape. But I just I'm in healthcare, but I love health. I love to exercise and do some of those things. So that's incredible. So just as we're wrapping up, I think maybe last week you went to Becker's conference. You spoke. You do a lot of work in the rural health or just healthcare space, innovation, technology, telehealth. If you had to, what would be a good takeaway, maybe a final takeaway that you would give our audience, advice as far as, what you do in the rural health space, summarize this in kind of a big takeaway for our audience.
Yeah. Again, a lot of the folks that are probably listening to this are probably in that rural health or know somebody, maybe one of their peers that's in that kind of rural health type of setting. I think where my type of organization lies is that access side of things, where having telehealth services and the access point of getting care, I'm able to do that 24/7, and so that side of it I think is really a key component. As mentioned, everybody's got the technology of phones and iPads and connectivity pretty much across the country, and so services like mine can provide that instant access, but also that instant care to patients, either at pediatric or adult levels. And so, I think that's where the ecosystem is in desperate need of really getting to is that instant access. People don't want to wait hours. They don't want to wait, and drive 45 minutes to an hour to get to someplace and then wait. They want to get that kind of immediate satisfaction of instant care. And so that being provided, I think, is a win-win. And I think the outcomes part of it is obviously the win-win too, where you get better outcomes because of that access. You get better disease outcomes. You get better disease management because of that access. And I think that's the true driver of what our organization is doing and what it can do for the services for some of the folks that are listening here on this podcast.
Excellent. Access to care, and that's what you can take home with. Well, I just want to take this opportunity to thank you very much, Mr. Eric, for what you're doing in just healthcare technology, innovation, helping with access, just making things better for the people that have difficulties, especially maybe in the rural community, for access to healthcare. It's really important. Last year I was actually the keynote speaker for North Dakota Rural Health Conference, and those are some of the issues that they have, just access, and it's just incredible. So what you're doing is amazing. Thank you. And what is the way to reach you if they're gonna?
So they can either go to either www.qchealthcare.com. They can go to www.mypediatricdoctor.com. or myadultdoctor.com. So all those are up and running. So they can do it there, or I'm on LinkedIn. So Eric Doherty on LinkedIn, link up with me. You'll find me very easily.
Yep. He's very active on LinkedIn. That's how we connected. So,
yep.
Well, thank you very much, Mr. Eric. Have a great day.
You too. Thank you very much for your time.